Wherever people live, work, or travel, infectious microbes are along for the ride, causing deadly diseases and threatening human health. And recently, new threats like SARS, avian flu, and the H1N1 flu have emerged, raising serious concerns that a new disease will cause a global pandemic.
If you just think about it evolutionarily, our generation time is 20 years, and these bugs have generation times of an hour, 30 minutes. So of course they're going to be adapting and changing as we evolve much faster than we are. So things are going to pop up all the time. We've been exposed to some brand new diseases that have jumped from animals to humans, but we're talking like the past 100 years or so. And also speed of travel is obviously massively increased. So the transmission rate can be, what was just a little pocket of infection can go from other end of the world in just a matter of a few hours.
The challenge for scientists is trying to stay one step ahead of these threats.
The good part, which isn't so bad, is that our technologies have advanced so much we're able to detect these viruses and these bacteria much faster and a much broader breadth of different things that we never would have even noticed before was there.
For every new infectious germ identified, vaccines still hold the greatest promise to protect society.
They are still the most effective intervention that we can have, biomedical intervention that's ever happened. So vaccines, even as they exist today, are extremely important.
Kathy Sykes is a researcher at ASU's Biodesign Institute. Along with colleague Bert Jacobs, she leads a team that is working on new technologies to rapidly speed up the development of new vaccines.
If you're really good and really lucky and you happen to find the whole pathogen vaccine that works sufficiently, it could take as little as 7 to 10 years to develop a whole pathogen vaccine. The subunit vaccines are more difficult because you have to do the discovery phase first. What we're doing here, we should be able to bunch that all discovery and then to testing and the relevant host within a year.
In their first demonstration project, the team has chosen a virus that has had a big impact on the pork industry. It's called the African swine fever virus.
We want to apply this to many different pathogens, anything that comes up. Well, this one came up about 2 years ago in Georgia. It just completely wiped out the animal export and pork production industry, wiped out. I mean, it's 100% lethal, no pigs were there.
The virus was chosen because it represented a scientific challenge to provide proof of concept for their rapid vaccine technology.
And so it was kind of the Goldilocks-sized genome, where it was a very, very large virus, and viruses are generally small. And so it enabled us to show high throughput technology on sort of a manageable scale.
The goal of the project is to identify only the key parts of the virus that can be used to develop a safe and effective vaccine.
The trend is in the field of people studying this is to go to using pieces and parts of the pathogen rather than the whole thing. We refer to this as the subunit vaccine, meaning just a component, a piece and a part. And that gives us the opportunity for a great deal of safety and consistency over these whole viruses or whole pathogens.
At the heart of the technology, the team identifies a new pathogen and then sifts through all its genes to hone in on those most responsible for causing a disease.
But what we developed along the way and now we're applying to the rapid discovery of these partial pieces of the pathogen that are protective is that we have technologies that can go through very quickly and see all of the immune responses that a pathogen can possibly raise. And then once we do that, we sort them and we bin them, if you will. We make little baskets and we categorize every single piece and part of the pathogen into what kind of immune response it raises. Then we take a sample from each basket and we test it directly in the real host in a very small, fast vaccine assay. And we know which basket has all of the protective antigens.
But the key challenge is trying to find the perfect number of protective parts within the virus in order to make the best vaccine.
So that's the conundrum that we're in right now. We recognize the safety and the consistency power of the subunit. However, we don't know which piece and part to use. And even when we do find a piece and a part that confers some level of protection, it's always partial protection. It's not nearly as potent as the whole bug itself. So what Dr. Jacobs' group and our group here have come to terms with is it's not going to be one piece. It's going to be a collection of pieces that cooperate together to confer that full protection. And what the technology development has to be is how are you going to find this minimalistic complexity.
Once they demonstrate success, their approach can be applied to other leading world public health problems, including malaria.
If you have a pathogen that's highly diverse, such as malaria, it's even more compounded, the issues you have to deal with. But we think that our ability to categorize and sort and then have literally a whole bin's worth of antigens, all of which could potentially be protective, if we could pull some of those together, we should be able to be broadly protective against any particular isolate and any particular person.